Welcome back. Doctors and nurses in central Indiana working so hard right now helping patients with coronavirus. But obviously, they're not the only people who need medical help right now. And doctors want to get the word out that emergency rooms are open. Joining me is Dr. William Freudenthal, president of St. Vincent Emergency Physicians, to talk more about that. I understand you just finished your shift, so thank you.
Had a night shift here in Indianapolis.
Tell me how things, let's just take, for example, last night, for example, obviously HIPAA, nothing specific, but how did that shift go for you and what kind of folks are you seeing come in?
We're still seeing a lot of patients with medical problems, but nowhere near what we normally see. So we saw patients who were having symptoms of heart attacks. We saw them having symptoms of strokes, but nowhere near what we would typically see on a Tuesday night in April. It was actually kind of quiet.
I know that some people have been fearful, and actually my coworker Ray, he had a friend who's a doctor who had a patient that didn't go to the hospital because he was afraid. It was a sliver, but it got so infected that he almost lost his finger. Are you seeing that or hearing where patients are just, maybe they're having symptoms of a heart attack or something, but they don't want to go because they're fearful or they think the ER's closed down?
Exactly. We're seeing lots of patients with a multitude of symptoms, from abdominal pain, and they'll have a ruptured appendix. We're seeing patients who've had chest pain that wait 2 or 3 days to come in, and they've had a heart attack that could have been taken care of in a more timely manner. And the problem with that is they increase their risk of complications. They increase their risk of a more severe disability long term if they don't take care of those things quickly.
Yeah, doctor, I think it's important because obviously you don't want people just to come in, for something that they don't need to go to the ER. But also you want them to go if they feel like they need it. What are you doing to try to keep those patients safe from each other? And then when should they come to the ER?
Yeah, at Ascension St. Vincent, we've established protocols for both our intake of patients. We have a special intake area, which is separate from our treatment area. We have distancing in the waiting room to keep them away from other patients. We've limited visitors, which also keeps traffic down in the hospital. Our staff are using PPE to protect not only themselves, but also to protect our patients and to make sure that all our patients are taken care of in a protected environment. We've established safety and sanitization protocols for our EVS staff to keep our rooms clean and make sure that those patients are protected.
Doctor, we sure do appreciate it. Thank you so much, and especially after coming off of a shift. We know how hard you've been working, and just big thank you to you guys.
Well, you're welcome. Thanks to everyone out there.
Absolutely. Okay, and Ray, my goodness, your doctor friend. Think about that person that didn't go